And now here back at home, new tonight, to the looming question: how did a bedridden woman with a loaded gun get inside her room at one of Louisville's busiest hospitals? Police say she fired off 4 shots, damaging the room inside Baptist Health East in St. Matthews. WHS 1119's Clarice Shaley and photojournalist Levi Hammer talked with a former nurse, now a Kentucky lawmaker, about the incident.
Can I get some position units to start for Baptist East? Subject is fired.
A huge police force racing to one of Louisville's busiest hospitals. An early morning shock at Baptist Health East in St. Matthews.
You can send some 4th Division units as well.
Police say the patient is a woman named Mystic Rain. She was bedridden in her hospital room when she fired off 4 shots.
At this point, it doesn't appear that it was fired at anyone directly. It appears that some were fired out to the window and into the ceiling.
St. Matthews Police Chief Barry Wilkerson explains she got to Baptist this morning by helicopter.
The patient was actually airlifted in and was a direct admit to the floor itself. That's why I think some of the confusion of how did a gun get into the hospital.
Officials are looking into how the gun got into the room. Rain is charged with wanton endangerment and criminal mischief. Baptist Health tells us the situation was contained quickly, was isolated in nature, and resulted in no injuries. 21 patients were evacuated during the incident.
She did put a lot of people at risk and created a whole lot of fear.
Kimberly Moser is a state lawmaker in northern Kentucky.
I mean, that in a hospital situation, especially where patients were evacuated, really puts patients at risk.
She has experience as a neonatal intensive care and flight nurse.
I don't think anyone typically searches a patient's belongings when they're airlifting them, so I'm not sure how that occurred.
We asked Baptist Health about patient checks. They responded, quote, "When a patient presents to our hospital, our immediate priority is to assess and address their medical needs with professionalism and compassion." In a statement, Baptist Health says firearms are not allowed in any of their facilities, and they keep, quote, "comprehensive security procedures." Rain was quickly sedated and remained in Baptist for treatment. In Louisville, Clarice Shaley, WHS 1119 on your side.
Also new tonight, we did ask 2 of Louisville's biggest hospital groups about their safety procedures at their locations. U of L Health sending us a statement back saying in part, quote, "Weapons detection systems are utilized at several U of L Health facilities to ensure safety in places of healing." Norton Healthcare telling us in part, quote, "Norton Healthcare utilizes a layered security approach across our system that includes highly trained security officers, controlled access points, surveillance technology, and additional protective protocols tailored to each facility's needs and risk profile. As a general rule, firearms are not permitted in our facilities."